Unlike the 24 true vertebrae of the cervical, thoracic, and lumbar spines, the 9 vertebrae of the sacrum and coccyx are fused, false vertebrae. They progressively become smaller from superior to inferior, a reverse of the pattern that we've seen before. The sacrum is located posterior to the pelvic cavity, medial to the iliac bones, superior to the coccyx, and inferior to the 5th lumbar vertebra. It's classified as an irregular bone, triangular in shape, and consists of an apex, a base, and pelvic, dorsal, and lateral surfaces. It articulates with the iliac bones at the sacroiliac joints, the coccyx at the sacrococcygeal joint, and the 5th lumbar vertebra at the lumbosacral joint. The coccyx or tailbone is triangular and is classified as an irregular bone too. It is comprised of the 1st, 2nd, 3rd, and 4th coccygeal vertebrae. The coccyx is located inferior to the sacrum and articulates with it at the sacrococcygeal joint. Now, up to this point, we have primarily been focused on the axial skeleton, but as we transition to the sacrum and coccyx, we can't not consider their anatomy without also reviewing it as a link between the axial and inferior appendicular skeleton. You see, the sacrum and coccyx both contribute to the pelvic girdle, whose primary joints include the sacroiliac joints and the pubic symphysis. The pelvic girdle is a basin-like structure formed from left and right hip or coxal bones, the sacrum and coccyx. The hip bone consists of the ilium superiorly, the ischium posterior-inferiorly, and the pubis antero-inferiorly. These bones each contribute to the formation of the acetabulum. Anteriorly, the pelvic girdle is connected by the pubic symphysis. This consists of a fibrocartilaginous disc that sits between the medial aspects of the left and right pubic bones. Posteriorly, the ilium articulates with the sacrum and forms the right and left sacroiliac joints. The sacroiliac joints serve as the main link between the axial skeleton and the inferior appendicular skeleton, transmitting the weight of most of the body to the hip bones. Mobility at the sacroiliac joint is normally very limited, but some movement does occur. Forward rotation of the sacrum relative to the iliac bones is known as nutation, and backward rotation of the sacrum relative to the ilia is known as counternutation. Nutation tends to occur in load-bearing situations, like standing and squatting, while counternutation normally occurs in unloaded positions, like supine lying. The sacroiliac joint is comprised of an anterior synovial joint between the ear-shaped auricular surfaces of the sacrum and ilium, and a posterior syndesmosis between the tuberosities of the same bones. The articular or auricular surfaces of the synovial joint have irregular but congruent elevations and depressions that interlock. The joints of the pelvic girdle are reinforced by a network of ligaments. These include the iliolumbar ligament, which we've discussed already, the anterior sacroiliac ligament, the posterior sacroiliac ligament, the sacrotuberous ligament, the sacrospinous ligament, and the interosseous sacroiliac ligament. The posterior and interosseous sacroiliac ligaments are the main ligaments responsible for linking the axial skeleton with the inferior appendicular skeleton. They firmly attach the sacrum to the iliac bones. The sacrum is actually suspended between the iliac bones. The interosseous sacroiliac ligaments, which lie between the tuberosities of the sacrum and ilium, are the main structures involved in transferring the weight of the upper body from the axial skeleton to the two ilia of the appendicular skeleton. Due to the orientation of the fibers of the posterior sacroiliac and the interosseous sacroiliac ligaments, oblique, upward, and outward, the axial weight pushing down on the sacrum actually pulls the ilia inward, locking the sacrum between them. The iliolumbar ligaments are accessory ligaments to this mechanism. The anterior sacroiliac ligaments are just the anterior part of the fibrous capsule of the synovial part of the joint. The sacrotuberous ligaments join the posterior sacroiliac ligaments and fibers extending from the posterior margin of the ilium and the base of the coccyx to the ischial tuberosity. The sacrospinous ligament originates from the lateral sacrum and coccyx and inserts onto the ischial spine. Together, the sacrotuberous and sacrospinous ligaments work to counterbalance rotation of the superior sacrum in standing and landing from a jump. We'll finish up this lecture series on spinal anatomy by reviewing the muscles of the pelvic diaphragm, or pelvic floor, which separates the pelvis from the perineum. These muscles are arranged in a bowl-like fashion and support the pelvic organs. They include levator ani and coccygeus or ischiococcygeus. The levator ani muscles form the majority of the pelvic diaphragm, while the right and left coccygeus muscles form its posterior superior part. First, the levator ani muscle, which itself is actually a combination of three individual muscles: the iliococcygeus, the pubococcygeus, and the puboanalis. The iliococcygeus is broad and flat and is located medial to the ischium and ischioanal fossa, lateral to the urinary bladder, the rectum, and the pubococcygeus and puboanalis muscles. It provides support to the adjacent pelvic structures and elevates the pelvic floor. Its fibers are capable of maintaining a tonic contraction at rest, which relaxes during defecation. The pubococcygeus is broad and flat as well, and is located superior to the puboanalis muscle and medial to the pubis and the iliococcygeus muscle. It's lateral to the urethra, the rectum, the vagina in females, and the prostate in males. Some fibers of the pubococcygeus muscle have specific names. The fibers that lie adjacent to and attached to the vagina in females are known as the pubovaginalis muscle, while the fibers that lie adjacent to and attached to the prostate in males are known as the puboprostaticus muscle. The pubococcygeus muscle provides support to adjacent pelvic structures and elevates the pelvic floor. Its fibers are capable of maintaining a tonic contraction at rest, which relaxes during micturition and defecation. The final muscle in the levator ani group is the puboanalis or puborectalis muscle. This is a thick, narrow skeletal muscle located inferior to the pubococcygeus muscle, medial to the pubis and the iliococcygeus muscle, and lateral to the urethra, the rectum, the vagina in females, and the prostate in males. Like the iliococcygeus and pubococcygeus, the puboanalis muscle provides support to adjacent pelvic structures and elevates the pelvic floor. Its fibers are capable of maintaining a tonic contraction at rest, which relaxes during defecation. Finally, we have the coccygeus or ischiococcygeus. This is a flat, triangular skeletal muscle that forms the posterior superior part of the pelvic diaphragm. It's located anterior to the sacrospinous ligament, which it may also be attached to, superior to the iliococcygeus muscle of the levator ani, and inferior to the piriformis muscle. The coccygeus muscle provides support to adjacent pelvic structures. And that concludes this lecture series on the osseous, articular, and muscular structures of the spine. In this lecture, we went from superior, the cervical spine, to inferior, the sacrum and coccyx, covering structures that span the entire length of the spine, like the intrinsic and extrinsic back musculature, to those that are area-specific, like the neck musculature. These lectures were prepared as a primer for university-level students in the healthcare disciplines and shouldn't be considered a comprehensive overview of anatomy, nor should they directly inform medical diagnosis or management.